My name is Dr. Kilingo. I'm a cardiologist practicing in Nakuru and also in Nairobi, Kenya. So congenital defect refers to structural abnormalities of the heart, which involves the blood vessels and the heart structure, and usually occurs during pregnancy before the baby is born. So there are several types, and we look at it usually in terms of, is it simple or is it complex congenital defect? The simple ones are usually things like atrial septal defects or ventricular septal defects, what we in layman terms refer to as holes in the heart. And you can have also very complex defects that involve various vessels in the heart and the chambers of the heart, things like what we call the tetralogy of Fallot, which usually presents more so with cyanosis. We also have what we call transposition of great vessels, and many other defects, which some of them can be so severe that they are not actually compatible with life unless something is urgently done after delivery. So the significance of early detection, especially, and nowadays that you can even detect them in utero. You can have ultrasounds done even in pregnancy, and detection is done so that particular defect can be appropriately handled or repaired after birth, immediately after birth, for some of them that may not even allow the baby to live for long after delivery. Unfortunately, there are some situations where the defects are so severe that you may even recommend termination of pregnancy because that baby is unlikely to survive after delivery. Yeah, so the causes, you can look at them in terms of those that are genetic or inherited, and those that are acquired either from environmental factors or even maternal factors. So the genetic ones usually is, for example, where you get chromosomal abnormalities during the development of the fetus, like what we call trisomy 21, commonly known as Down's syndrome, which commonly presents with ventricular septal defects, among other malformations. And you can also have maternal factors, for example, old age. I mean, women who give birth at an advanced age, above the age of 35, probably more likely to get babies with congenital malformations. Also, maternal factors like smoking, alcohol intake during pregnancy, or any other medications that the mother may be using, some of them that might be teratogenic, can cause congenital malformations. We also have environmental factors, for example, infections, some viral infections, like what we commonly refer to as torches, can cause congenital malformations. Of course, you have other factors, pollution, and lack of proper nutrition can cause some vitamin deficiencies like folic acid, which can also cause congenital malformations. The symptoms now we are talking in terms of, well, of course, when the fetus is in utero, may not necessarily present with obvious manifestations, but there are some things that can happen in the course of pregnancy that would suggest that probably there's a problem. For example, if the baby is not giving the usual fetal movements, then that might be a pointer that there might be a problem. Or if the mother has what we call oligohydramnios, in other words, the amount of fluid in the uterus during pregnancy is less than usual, that can be a pointer. But again, the manifestations, of course, will be after delivery. Some of the babies may present with severe cyanosis, that is blueness of the baby, the whole body, or especially the face and the extremities. That can be a pointer that there is something wrong with the heart. And of course, it requires urgent diagnosis because, as I mentioned earlier, some of the malformations may not be compatible with, with the life. So if it's not corrected immediately after delivery, like what you call transposition of great arteries, that one may lead to fetal demise. The other, of course, as now the baby is born and they grow older, they present with manifestations like shortness of breath, and of course, even in the infant stage, they will not be probably feeding very well. They'll be having recurrent infections. They have what we call failure to thrive. They are not, the milestones, are not as expected. And later on, if they have malformations that can allow them to even grow into early childhood or teenage, they will have severe dyspnea or shortness of breath. They can't play in school like the other children. That can be a pointer that there is something wrong with the heart and they require further evaluation. Of course, most of them are seen by the penetrations and they're able to pick it up when they are young. But we also see even in adulthood, there are some who actually persist with malformations, especially those who are born with simple defects like ventricular septal defects or atrioceptal defects, the so-called holes in the heart. Some of them can persist actually up to adulthood, and they can be picked even incidentally when they present for other medical evaluation. But most of them, especially the severe forms of congenital disease, will be picked at childhood. So the most commonly used tool and what is readily available even in our setup is a simple ultrasound or what we call echocardiography. You can actually be able to pick any structural abnormalities of the heart using echocardiography. Of course, for those very complex defects, you also need further evaluation. You can do other imaging like CT scans and MRIs. But a simple echocardiography can actually detect the defects. Yeah, so of course, this being a structural problem of the heart, definitely the management is to fix that structural problem, which is surgery. Of course, there are other medical management and supportive management like oxygen therapy and diuretics, maybe when they have symptoms of heart failure. But by and large, congenital defects are surgical problems that should be corrected surgically. And so the definitive management is surgery. And some of them actually, when they are detected early, like the simple defects like ASD, VSD, the closure is not complex surgeries, and those children can live a normal life. But of course, if it's detected later in life, they may have undergone what we call a major syndrome, and that means even those simple defects can now turn into very complex problem which cannot even be surgically corrected. The other ones, of course, the trilogy of Fallot can also be corrected, and most of the children get to live a fairly normal life. Of course, it requires a follow-up later in life for any eventualities from the surgeries. And those are the ones, some of them end up in adulthood, and we follow them in the adult clinics. Yes, to some extent it's preventable. Of course, there are those genetic problems that may not necessarily be preventable, but of course we are advancing in science. We are not talking about things like even gene editing and stem cell therapy. Yes, that probably in the future, but the most important thing is to prevent conditions that can result in congenital defect, like I mentioned earlier, maternal infections, and lifestyle risks like smoking, alcohol, and proper nutrition and proper environmental management strategies, waste disposal to avoid pollution. Those are some of the things that can be done to help prevent congenital heart defects. Yeah, so yes, of course, now we are talking about congenital heart defect today, and for me, actually being an adult cardiologist, I probably talk more about other lifestyle conditions, diseases that are more preventable than probably congenital heart defect, because things like what you eat, exercise, and issues of smoking, alcohol. Those are things that are fairly in your control, and conditions like hypertension, diabetes, which can lead to some of these cardiovascular diseases, can be prevented. So the point is, even as you celebrate Valentine's, then of course you do it in a manner that is not injurious to your heart. And of course, regular checkup is also advised, especially in people who have reached at least an age of 40 and above, should get an annual full medical evaluation, including cardiovascular evaluation, and anyone else for that matter who may have symptoms of heart dysfunction, shortness of breath, unable to function as they used to do, coughing, not able to lie in bed at night properly without using several pillows. Maybe those are swelling of the feet. Those are some of the signs that there could be something wrong with your heart.